Good afternoon, everyone. It's so nice to be here speaking with you. So I'm Dr. Bryann DeBeer. I am the director of the VA Patient Safety Center of Inquiry Suicide Prevention Collaborative. That's a national center within the VA that seeks to develop solutions to suicide prevention for veterans who are in the community. I'm also a clinical research psychologist at the Rocky Mountain MIREC. So that's Mental Illness Research Education and Clinical Center. So there are probably about 12 MIRECs across the country in various areas. And the one in Denver is focused exclusively on suicide prevention. So the mission is to reduce suicidal ideation and behaviors among veterans by identifying cognitive and neurobiological underpinnings of self-directed violence. So a lot of my work is as a researcher, developing innovations and testing them around mental health and suicide risk in veterans. And the project I'm going to be speaking on today is funded by VA Mental Health Science Research and Development. And have been very grateful to work in collaboration with VNL. And kind of how a lot of this came about was I was introduced to them by a colleague I was working with and started working with them on my patient safety center. And then, some other opportunities arose and I thought, wow, PARTNERme would really be fantastic for this other project too. There's a lot of flexibility in being able to apply this tool in a lot of different domains. And so for my project, the pandemic occurred and I thought, for many years, I've wanted to look at a social network analysis in relation to suicide risk in veterans. And I myself don't have that expertise. And so when this came up, I thought, wow, Danielle's team can bring so much insight here into this issue, particularly surrounding COVID-19. We didn't know what was going to happen to our veterans when faced with social distancing and being isolated. And we know that being isolated is a risk factor for suicide. And I've done a lot of that work myself, looking at social support, but being able to look at a social network analysis really takes it to the next level in trying to understand where the challenges are and what is really happening, what's happening beyond perceived social support. That's somewhat of a rudimentary way to assess challenges with social connection. And so we applied for and received funding to examine the impact of social distancing and the COVID-19 pandemic on mental health and suicide risk via a social network analysis using the PARTNERme tool. We had 196 veterans. We oversampled for common mental health symptoms. And we were also fortunate that VA does have quite a research arm. Really, we do really try to improve the VA through research and innovation. And they were able to provide us with a database of veterans who had tested positive for COVID-19. So we were able to reach out to those veterans and ask them if they wanted to participate with us. And so we used the PARTNERme tool, asking about the period prior to the pandemic and current, which was November 2020 to January 2021. And I could probably talk about this project for 5 or 6 hours, but we don't have that much time. So I'm going to try to kind of condense it down and squeeze it. We found a lot of really interesting things, but just to some of the highlights, we weren't sure what was going to happen in terms of, would the veterans lose their social connections? And we did have a minority of the sample indicating that they had no social connections at all. But what we saw primarily was that dependency in their network increased. So there were a lot of increased needs like finances, behavioral health, healthcare needs. And so they depended on the people in their network more. But most veterans didn't have anyone in their social network to coordinate their needs. This was something that we did not know prior to this research, that when these needs arose, when they became more dependent upon their network, the social network was not there to support them, which is quite stunning and also indicates a need for VA to step in even more than they have and provide support to our veterans. And something else that was very interesting was that we found that low social connectedness was associated with PTSD and depressive symptoms and suicide risk. And so what we see is that this social network analysis does indicate an association with PTSD and depressive symptoms, and then that increases suicide risk. It gets complicated with this type of modeling, but when we take PTSD and depressive symptoms out of the model, there is a direct association between this type of social network analysis and suicide risk.